My name's Michelle Grange and I'm a community matron. And my role is about looking after people with long-term conditions at home and trying to keep them as well as possible to avoid unnecessary admissions into hospital. So much of care can be fragmented. You get to see different people each time. They're having to repeat themselves 10 times over around the same information, whereas they don't have to do that with us as matrons, and we're able to coordinate that care, so it simplifies everything for them.
The real excitement of our services is that we can provide integrated care, so health and social care working together, lots of different professions working together, putting the individual at the heart of everything they do and designing care packages, solutions, all kinds of different opportunities around individuals so that they can maximise their life chances.
It's about a whole team, so then you've got community nurses, you've got extremely, fantastic skills around managing the patients in the community. We've got the GPs and the doctors, you've got the consultants. So to prevent someone going into hospital, it's about the matron coordinating and pulling everything together. The matron knows that person really, really well, but then utilises everybody else to actually ensure that that person gets the correct care. One of the things that we provide is something called Telehealth, which is a piece of equipment that can monitor people remotely from afar. It gets sent through to the urgent care centre, and there is a team of people there that will look at the readings each day.
Well, each morning I do all this, like blood pressure and this, and I would add my weight, and then he asked me lots of questions on there. When the girls ring up, I want to find out how I am, especially when you're on your own. That's what I think is nice, because I can say to them, well, I'm feeling rough or what it is. You know there's somebody listening to you, don't you, the other end.
Hello, you're through to Gemma Black. Hello, I'm very well. How can I help you today?
I get to speak to the same patients most days. On wards, patients come, patients go, and you may never see them again. So you really build up these relationships, these therapeutic relationships. And sometimes you're helping them get better. You're talking them through what could be wrong, and you're getting the right people in quickly for them. And you know that without that service, they may be at home until it's too late.
Working in an integrated organisation, people have been really flexible. So we now have nurses carrying out community care assessments, supporting their social work colleagues, and we have reablement workers undertaking basic tasks at home that perhaps nursing assistants or nurses might have done. So people have developed new job roles, they've changed the way they work. A good example of how integration has helped is our reablement service. So people may need to go into hospital because they have a crisis of some sort or other, and our reablement team look at providing support on the functions they need to recover to be independent at home. The unusual bit is our reablement team has therapists in it, as well as care workers and as well as nurses if necessary.
When Tom came out of hospital after the stroke, he couldn't do a thing. They were here for 6 weeks, and during that 6 weeks, gradually they got him to do things himself. After a couple of weeks, they got him up the stairs once a day, twice a day, then 3 times a day, until he was confident to go up there on his own.
It's different to being a carer. Reablement is so different. I'm very passionate about my job anyway, but I do feel that people need to stay in their own homes, have their independence back, and SEQOL, I think, are doing that.
And also the occupational therapist came before he came home, and they put in every bit of equipment that would help Tom. So from the start to the finish, it's a brilliant service, absolutely brilliant.
We have 2 meetings every week on a Monday and a Thursday. Sitting around the table, we have district nurses, we have occupational therapists, physiotherapists, social workers, sometimes reablers come in if they're not out working, and we go through a list of all the service users that are receiving care at any one time. So I think this is why our reablement team works so well. I mean, the results that we're getting are amazing because we're tailoring the service down so slowly.
I think it has a huge impact for patients that keep having to go in and out of hospital. It's really demoralising. They get very depressed, almost give up at times. So to know that they can be kept at home and they've got one friendly, familiar face who knows them really well and has got those extra advanced skills, who can come out at a drop of a hat to deal with the issues that they've got, I think is extremely important and valuable.